Anxiety from smoking is a very easy thing to slip into if you don't know what you're doing.
First-time users, vaping can result in a much higher dose of cannabinoids compared to smoking, which can lead to adverse effects, potentially trigger schizophrenia, psychosis in those predisposed to it.
It's well known that the whole of the Channel Islands has a problem with alcohol, and we know there is an underlying problem with things like opioids as well. But when you consider that you've got triple the problem when it comes to alcohol compared to everything else combined, why is that not on the front page of the press?
In my opinion, these are fear-mongering tactics used by the press and anti-cannabis groups.
There's no other way of putting it.
And you must stand united on this. Stamp out the spiteful assassin of our youth. You can do it by bringing about compulsory education.
Hi guys, thanks for joining us for episode 2, where this week we're diving into a bit of a more delicate subject, psychosis, and everything that surrounds psychosis and cannabis. And Bruce is really putting some time on this episode, so I'm going to let him take it from the top.
Our goal with this episode is we're not trying to dismiss the existence of psychosis. We fully recognize that psychosis is a real condition, and we do acknowledge that there is a correlation between cannabis and psychosis. We're not doctors, nor do we claim to have the knowledge of a doctor. We're simply just going over studies and statistics that have been carried out by professionals, as well as our own personal opinions and experiences.
Yeah, I think to start off on the right foot, I think it's important for us to put the definition of what psychosis is. I think it's good for us to start on a level playing field so everybody kind of knows where we're coming from. So psychosis is a mental health condition characterized by disconnection from reality, often involving hallucinations and delusions. People experiencing psychosis may have trouble distinguishing between what is real and what is not, leading to disorganized thinking and behavior. Psychosis can be a symptom of various psychiatric disorders, such as schizophrenia, bipolar disorder, or severe depression, and can also be triggered by substance abuse, medical conditions, or extreme stress. Treatment typically involves a combination of antipsychotic medications, psychotherapy, and support services.
Start jumping into articles here. The first one I want to jump into. So this article was written by King's College in London, and the title is Skunk-like Cannabis Associated with 24% of New Psychosis Cases. Scientists have found that 24% of all new cases of psychosis are associated with the use of high-potency skunk-like cannabis. In addition, the risk of psychosis is 3 times higher for potent skunk-like cannabis users and 5 times higher for those who use it every day, according to research from the Institute of Psychiatry, Psychology, and Neuroscience at King's College London. Can you explain to me what the skunk-like cannabis is? Because, skunk is just a strain.
That's exactly it.
Where did this association come from? And
the tarring with a brush, that's what it's been, yeah.
How did this start? Is what I'm curious about. Where does this come from by using the term skunk cannabis is like a completely different breed? How did that start here? We don't categorize things like this in America as far as skunk-like cannabis. What exactly is that here in the UK? It's used the term skunk-like cannabis. What exactly is that?
To be honest, even after trying to search for where it came from, I had no idea. And it seems like there's been a very big split between the US and the rest of the world on what skunk is categorized as, because I remember being younger and the word skunk being passed around, and it was classed as some real, really potent weed and, difficult to get, etc., etc. And I think it's just an extremely uneducated point of view from Europe. I think that's all the only conclusion I could really get to is that's just how it's come around. And obviously it's been latched on to by outlets and just people that just aren't educated in what it actually is.
So obviously then there's a misconception that skunk is some sort of super strain that uniquely causes mental health issues, right? That's just not the case. And I think it's important to clarify that skunk is simply just one strain among many strains. Doesn't possess any kind of special genetic that makes it more harmful than other strains. Tons of skunk crosses out there. You have Hawaiian skunk, early skunk, Shiba skunk, Sensi skunk, and so on. There's tons of them. And they're good strains. Each strain, whether it be a skunk strain or any other strain, these strains contain cannabinoids, right? They contain terpenes, just like any other variety does. And I think understanding the science behind it can help to actually dispel these kinds of myths and lead to more informed conversations because language like this, saying skunk like cannabis, it's actually hurting the conversation, in my opinion. That kind of language would basically put out there to all these medical clinics and all these growers, we shouldn't grow skunk strains for medical. I don't agree with that. In fact, skunk is just a strain. So moving on a little bit, so from what I've been reading then, is most neuroscientists agree that the roots of schizophrenia, psychosis, can be traced back to fetal development. In other words, schizophrenia is considered a neurodevelopment disorder, right? So with that being said, it's highly improbable that cannabis would cause schizophrenia in an individual who would not otherwise develop the disorder, right? However, cannabis can potentially trigger or exacerbate psychosis without being the primary cause, right? So those effects have also been observed in other substances like psychostimulants, nicotine, right? And you have steroids, alcohol, all of which can trigger psychosis as well. So one early study of male Swedish conscripts findings that cannabis users were up to 6 times as likely as non-users to develop schizophrenia. Among the respondents in this study regarded as high cannabis users, however, there was also an increased risk for schizophrenia associated with cigarette smoking and alcohol consumption. I would say that these studies become more complex now, right? Because the biggest challenge is the difficulty in isolating the effects from cannabis, tobacco, and alcohol due to the overlap of usage, right? So person comes in, with psychosis, but they have all of these substances in their body. You can't say that cannabis caused it. Here, let's go over this study here. So here's a table that has a ton of studies on here that shows risk for psychosis associated with cannabis and tobacco use. These numbers, the figures represent odds ratios and risk ratios. So just to kind of give you an idea here, one study showed that cannabis was 4.15 compared to tobacco at 3.97. Another one here shows cannabis at 1.14, tobacco at 1.03. I mean, there's a whole list of here. You can click into them, look into them. We'll post these on the YouTube site. But what this shows me is that cannabis and tobacco are relatively on par, right, for showing risk of psychosis.
And it'd be interesting to see what the public's view would be if these statistics were pumped down side by side.
Yeah, exactly. The one in here I kind of want to bring up is kind of off subject of psychosis, but I found this to be quite interesting as well, is the risk for traffic accidents associated with cannabis and alcohol use. Again, these numbers represent adjusted odds ratio combined for all the dosage levels. So you have cannabis, and this study shows 0.82, alcohol 8.0. This study shows cannabis at 1.1. This one shows alcohol at 3.2. You have another one here, 2.7 for cannabis, 6.0 for alcohol, 1.91 for cannabis, 9.79 for alcohol. I mean, you guys can see where this is going. It's alcohol impairs you way more than cannabis does when it comes to driving. So, I mean, with all this being said, I never really realized that cigarettes to be linked to mental disorders. After reading that, it kind of makes sense because most people with mental disorders chain smoke, right? And the reason is to relieve the stress and anxiety. But studies are showing that it could be making the conditions worse. It's a psychostimulant. So I also think that going back to the traffic one, tolerances have to be taken into consideration, especially when it comes to cannabis use and driving. Medical patients who are used daily have a much higher tolerance and are capable of operating a vehicle, as where the weekend warrior who's just puff and tough on the weekend is going to be more impaired and shouldn't operate a vehicle. And studies from places who have legalized cannabis have shown this as well. I'm not going to get into those studies. That'll be for another episode. I just kind of want to point that out a little bit.
Just to jump on that as well, though, we're not comparing cannabis and driving to alcohol and driving. We're not doing that. What we're saying is you can put a comparison to using cannabis and driving, whereas another medication and driving, because I myself, there's certain medications I can't take, like codeine, I really struggle with. And I know for a fact that I can't, if I have to take codeine, after when that codeine actually starts to take effect, I know that I can't drive for a while because it does send my head into a bit of a spin, and you've got to take the safe route. But I know, as someone who uses cannabis as a medical purpose, I know that I would be okay to drive. We're not putting the emphasis on cannabis being a comparison to alcohol, more cannabis being a comparison to a medication.
I agree with that. Because people who are taking opiates every day, they're getting up, they're taking their opiates, they're getting dressed, they're getting showered, they're driving into work. That's no different than somebody who's waking up, using cannabis, taking a shower, getting ready, driving into work. There is a tolerance there, right? Like you're saying, if somebody's just had their wisdom teeth pulled and they ate a couple codeine, you know what I'm saying? They're going to feel that effect. Realize I can't drive. But if you're a daily user and you're medicating daily, that's a completely different scenario. You have a tolerance. You're able to function in everyday life while taking these medications. So I read this meta-analysis too by Scholler and colleagues on continuous cannabis use in patients with psychosis. It's an interesting one. We'll put it in the link because there's just a lot to it. But me personally, what I took away from it is that I think that they did a great job trying to provide empirical evidence. However, I do feel like the interpretation kind of extended beyond available data, just like all the other meta-analysis that I've been reading through. These are correlation studies, and they clearly state that they can't prove causation. From my personal opinion, and from what I've been reading too, is a lot of people, and in some cases, psychosis leads to cannabis use rather than the cannabis causing the psychosis, right? So if you have people that are experiencing symptoms of, say, anxiety or whatever symptoms they're experiencing, they're going to try to turn to cannabis to try to alleviate those symptoms. And in some cases, that doesn't happen. It actually makes those symptoms worse. But we wouldn't know that until you tried it, right? So moving on. So CBD, from what I've been finding, there's a growing body of evidence that has found CBD can actually reduce symptoms of psychosis. So CBD, instead of impacting the dopamine system like antipsychotics do, CBD modulates the endocannabinoid system instead. So the first CBD schizophrenia clinical trial was conducted in 1995. The study subject was a 19-year-old female. The researchers gave her 1,500 milligrams of CBD every day for 4 weeks. They found that it helped improve her acute psychotic symptoms. So in Table 1, overview of studies investigating cannabidiol in patients with psychosis. This study shows one patient with schizophrenia, open label case report, up to 1,500 milligrams a day for 4 weeks. This is the girl I was just talking about. Significant reduction in positive symptoms. Another one here, 3 treatment-resistant patients with schizophrenia, up to 1,280 milligrams of CBD a day for 4 weeks. Mild improvement in 1 patient, no response in 2 patients. This study here, 6 patients with Parkinson's disease with psychotic symptoms, up to 600 milligrams a day for 4 weeks. Significant reduction in psychotic symptoms. I mean, there's so many of them here. 33 patients at CHR for psychosis, randomized double-blind design, single dose of 600 milligrams. CBD normalized brain function in CHR individuals in regions where CHR individuals showed abnormal activation under placebo. Yeah, so there's a few studies there that are showing that CBD actually helps to reduce psychotic episodes.
And you said that was from 1995, was that?
The one from the 19-year-old girl was from 1995. A lot of these studies are from that point on through the 2000s. And so the conclusion to this is what they found is initial clinical trials suggest that CBD is safe, well tolerated, and may have antipsychotic effects in patients with psychosis. There is some indication that CBD may be particularly effective in the early stages of the disorder, such as in patients at clinical high risk and those with first episode psychosis. So, I mean, that's interesting to me that, using CBD to reverse these effects and to make them more mild is, I mean, to me, that's groundbreaking. And why are we not using CBD more?
Yeah. Why are the studies not out there? From the medical side of that as well, when you look at the strains that are currently being brought into the market for medical use, what is the CBD content?
There is none.
Yeah.
We'll get into that as well.
Yeah.
But yeah, that's a big problem, is not having access to CBD flower. But yeah, I'll get into that too. But I do want to discuss is smoking versus vaping. I know it sounds kind of odd to bring that up in an episode about psychosis, but explain why. First-time users, 9 times out of 10, end up smoking rather than vaping. It matters because smoking delivers fewer cannabinoids and terpenes compared to vaping. And studies have shown that vaping is significantly more efficient than smoking. So when it comes to delivering THC, vaping could achieve up to 50 to 60% efficiency with it compared to smoking, right?
Which only manages 20 to 30%.
The rest of that's lost to side-stream smoke, right? It's just being burned up. So let's do a little math on this as well. So let's say you have the average flower, let's just call it 20% THC, right? Your average joint holds between a half a gram to a gram of cannabis. Let's just say it holds a gram of cannabis to make math easy. So using the same average THC percentage,
A joint could deliver up to 200 milligrams based on it being
20% THC,
a 1 gram joint, 200 milligrams.
so if you're taking in 200 milligrams of that, but you're only absorbing 30%, you're only getting 60 milligrams of THC. So versus vaping, where you're actually pretty much doubling that. So you're getting, say, up to 60%. So now you're getting double that, 120 milligrams of THC. So to me, this makes sense, right? Because I think of it as extracting cannabis, right? So vape devices to me are essentially mini extraction devices. I say this because when you're extracting cannabis, whether it's BHO, rosin, CO2, etc., you're extracting the oils that contain all the cannabinoids and terpenes. You're leaving the plant material behind. This is the same process as vaping. You're concentrating it. And the only difference is that you're vaping it right away as you're extracting it, as opposed to BHO or rosin, you're extracting the oils and then using them later. So it's the same process. And I bring all of this up because for first-time users, vaping can result in a much higher dose of cannabinoids compared to smoking, right? Which can lead to adverse effects like THC-induced anxiety and potentially trigger schizophrenia, psychosis, whatever you want to call it, in those predisposed to it. So it's not that I'm advocating for smoking, and nor am I saying that smoking wouldn't cause these ill effects. But I think it's important to note that vaping is much stronger than smoking and should be taken into consideration when prescribing for first-time users.
Especially when, because I think every smoker at some point has had some form of anxiety from smoking.
I have,
Yeah.
and I've been a heavy user for decades.
Yeah.
You know, and it just depends on that strain. Sometimes you get anxiety from it, you know? It just, it just depends.
Yeah. Because I had from a strain that I'd never tried before, obviously vaping, through a medical script. It's the first time I found out that I was sensitive to a terpene, was because I was vaping. And because it's, the way it works obviously is to heat up the cannabis to a desired temperature to rip everything off. And yeah, it was the first time I'd ever felt chronic anxiety, and it was horrible. And I say that took me down the path, obviously, at the start to my terpene journey to figure out what was what.
Yeah.
But it's a very easy, anxiety from smoking is a very easy thing to slip into if you don't know what you're doing. And I say that, yeah.
And then, I mean, for some people too, who don't realize that THC can actually cause anxiety, you have people that have anxiety and then try to turn to cannabis to treat it, but make it worse, right? So you have those instances as well. So we're going to jump into the headlines then. Psychosis and A&E visits due to prescribed cannabis. This was on Thursday, May 16th of 2024. States that medical cannabis has been blamed for a spike in cases of both psychosis and persistent vomiting. Since cannabis became available on prescription in Guernsey, more patients have been admitted to the Oberlin Center having lost contact with reality. I find this extremely interesting because on July 18th of 2024 in the Bailiwick Express, Deputy Al Brohard said, whilst there has been no significant increase in the total number of admissions to the Oberlin Center, it must be acknowledged that there has been a marked increase in such admissions where cannabis is quoted as an associated factor rather than a cause since the introduction of medical cannabis. This kind of goes back to what I was saying before about individuals using cannabis to alleviate symptoms of psychosis and having adverse reactions. So of course you're going to see people coming in that have more people having cannabis in their system because it's more readily available. Here it's on prescription now, and people are going to get it to try to alleviate these symptoms, and that's not always going to work, unfortunately, right? So yes, you're going to see the increase of cannabis in people's system coming into the Oberlins. So Dr. Neil Wright is a psychiatrist at the Oberlins and a prescribing doctor for Pure Health. Dr. Wright called on the states to tighten regulations to prevent further harm. The states have allowed a situation to develop where we have loose prescribing, he said. Prescribed cannabis can be sold on and there is no control over who gets it. I'm going to disagree a little bit. I don't think it's due to loose prescribing, as suggested here, as he is a prescribing cannabis doctor and he does follow strict protocols, and clinics adhere to stringent guidelines for prescribing. To me, that says that the process and the prescribing process is anything but loose, right? The only place that I see where prescribing fails currently is categorizing our cannabis as indica and sativa. I'm beating a dead horse on that subject, but it's true. We need to switch away from those categories. Where I do agree with him is that the states have allowed the situation to develop and that prescribed cannabis can be sold on. I'm not going to get too deeply into that as this relates to the first episode that we did about the black market. So if you haven't watched that, go give it a watch. Absolutely. I'm going to get onto page 2 here. So Dr. Wright here says he has blamed the widespread use of medicinal cannabis for an increase in both psychosis and persistent vomiting in the years since prescriptions became available. Dr. Wright believed the problem stemmed from the way the legalization of medical cannabis in Guernsey in 2019 was handled. I'm going to have to disagree a little bit with that as well. I think regardless of the way it was handled, more people who have never used cannabis are going to start trying it. And they're not going to know how they react until they do at the end of the day. He does go on to say that the UK clinics did not fully understand the economic dynamics here. In the UK, illicit cannabis is much cheaper, so patients there were seeking medical cannabis for straightforwardly genuine ailments. I will say he does make a valid point. We did discuss this in the first episode about the illicit cannabis market being much cheaper in the UK versus Guernsey and so on and so forth. But I would add another reason for someone in the UK to get cannabis, and that's for legal protection, right? So a person can be prescribed 10 grams a month, but they may actually use much more that they're obtaining from the black market, right? Using the prescription to show legality at that point. So you have that situation to where, yeah, this guy's only getting 10, but he's using 50 and getting the rest from the black market because it's better quality in some cases and cheaper in most all cases. So Dr. Wright goes on to say, the black market demand has driven the breeding of cannabis plants to have less CBD, which has considerable medical potential, and more THC, which is psychoactive, and has medical potential. Add that in there. More natural products contain both CBD and THC, allowing only plants containing both would be the more sensible therapeutical approach, he said. I agree with him on the black market demand for high THC. So this happened when cannabis was made illegal, leading to the CBD being bred out due to the lack of black market value for CBD. So yeah, from that, the black market perspective, that makes sense to do that. THC has the psychoactive effect. That's what people are after on the black market. So breeding out the CBD from the black market perspective makes sense to do. However, I do disagree with the view that we should only allow ratio plants containing both THC and CBD. Just to break down what a ratio plant is, it's a 1-to-1 ratio of CBD to THC, 2-to-1 ratio of CBD to THC, or vice versa. These are plants that are both going to contain both of those cannabinoids, just in different quantities and ratios. Everyone's going to react different to cannabis depending on the strain. So allowing for high THC plants, high CBD plants, and ratio plants is going to give individuals more of a freedom to experiment and find out what works best for them at the end of the day. Additionally, I think cannabis shops like mine should be allowed to sell CBD flower. No medical grower is likely to invest into a multi-million-dollar or pound GMP facility, which is a good manufacturing practice, to grow CBD that's only going to sell for £2 a gram to the patient. It's not worth your time to do that. So allowing shops to purchase CBD flower to be sold on is going to be essential to this and actually help reduce a lot of these ill effects that people are getting because they'll be able to mix their CBD with their THC flower.
Absolutely.
You know, we're going to move on to this part here. It's kind of backing up a little bit in this article. It says, in response to recent questions from Deputy Dudley Owen about the number of admissions for psychosis, Health and Social Care Vice President Deputy Mark Leadbeater said the figures were not currently available but would be obtained. I do want to continue on with Deputy Leadbeater in the Bailiwick Express article from July 18th.
This is following questions on whether cannabis is leading to more
admissions to the Oberlin Center. So Deputy Leadbeater says, there are 4 pillars to mental health and well-being strategy: understanding and collating data sets, awareness, access and early intervention, service improvements, and responding to recommendations of external reviews, began Deputy Mark Leadbeater. The recent report on the mental health and well-being strategy is the first iteration, which only reports on the first pillar of the strategy, collating and understanding data. He goes on to say, so does the President agree with me that data in respect of substances associated with admissions to the Oberlin has not previously been routinely collected by HSC, so the stats presented in this first report on Pillar 1 have been put together by manually interrogating historic patients' records in order to make judgment as to whether or not cannabis may have been associated with any admissions. Patients may have used cannabis and potentially other drugs and alcohol too at some point prior to their admissions. And so given the overall admissions have remained fairly static, say for 2020 when they were around 50% higher than reported today, there is no evidence to suggest that cannabis is contributing to higher rates of admissions to secondary mental health services. And then Deputy Brohard goes on to say, the absolute risk of harm among cannabis users is low, even with heavy or daily use. 94% of heavier daily users of cannabis do not experience psychosis. And that's 6% to point out it was already there. The cannabis is just triggering it and exacerbating it. So I'd like to share some stats that I received from the Freedom of Information Act here in Guernsey that relate to A&E admissions. So the first stat, there are a couple of the questions I had asked. The first question was the annual number of A&E admissions for alcohol to date. And this is 2021, 2022, and 2023. And that's a combined total of 1,648 of alcohol-related attendances to the emergency department. Keep that number in the back of your head, 1,648. The other question I asked, the annual number of A&E admissions for psychosis to date, including the number of these admissions allegedly induced by cannabis, and among these cannabis-induced psychosis admissions, how many involved the presence of other drugs in the system? The answer I got back was HSC do not capture data on the harms due to the use of substances. Most admissions are coded with what the drug caused, in other words, cardiac arrest. Mental health admissions to the emergency department are not coded. So what I was able to get from this then, the below table shows drug-related emergency department attendances. There is no way of knowing what drugs these are. So here it shows from 2021 to 2023, you have controlled drugs, which would include cannabis, prescriptive drugs, which would include opioids, and then proprietary drugs, which includes over-the-counter stuff like paracetamol. So from 2021 to 2023, you have a combined total of all of those, the 542, which means alcohol emergency-related visits to the hospital are triple that of the combined of all the controlled drugs, prescriptive drugs, and proprietary.
And that really kind of puts things into perspective when you consider that it's well known that the whole of the Channel Islands has a problem with alcohol, and we know there is an underlying problem with things like opioids as well. But when you consider that, it really puts it in your face that you've got triple the problem when it comes to alcohol compared to everything else combined. You know, and why is that not on the front page of the press? Why are we not exploring that?
We're highlighting psychosis and cannabis extensively here. Wow, alcohol-related AD visits are 3 times higher than those caused by, like I said, controlled prescription and proprietary drugs combined. In my opinion, these are fear-mongering tactics used by the press and anti-cannabis groups.
There's no other way of putting it.
No, I mean, you can't, just right here, in the paper, like we went over before, in the very first sentence, it says there has been more patients admitted to the Oberlin Center. But then in the article here, it says that there hasn't. And then statistics show that alcohol is 10 times worse than, or 3 times worse than the cannabis emissions, or opioid emissions, or paracetamol emissions, whatever, however you want to look at it.
Just to highlight that kind of these are the statistics that we really want to push. And this is the whole point of us doing this, is to bring this to light. These are, like you say, scaremongering tactics. And just looking at the numbers alone is enough to see that's exactly what it is.
I got really nothing more to add to this. I think it's going to be important to remember that 99% of the issues linked to cannabis are actually caused by just one of hundreds of different cannabinoids. So THC, right? So if you tried cannabis, you had an unpleasant experience, don't write it off completely. There are so many more other cannabinoids and terpenes that you might benefit from, such as CBD and CBG, to name a couple. So, I mean, that's really all I got.
Everything that you've put together for today, all the links and everything are going to be on all the social media pages, so you can find them on YouTube, Facebook, Instagram if I can. And then so you can go back and see the articles that we've been bouncing information from.
So our next episode, we will have a guest on. This guest is from Jersey. He's a cannabis activist, as well as a founder of the End Cannabis Prohibition Jersey. He will be over with us on the next episode, filling us in on how things are going in Jersey, how it's progressing or not progressing.
Yeah, I think a big thank you to everyone as well, because we've had a really, really big response to the first episode across all platforms. Even we were kind of shocked at how many people were giving us feedback, good and bad. We really want to know everything. Please help us. Drop comments, let us know how we're doing. Give us ideas of the subjects that people want us to dive into. And please give us a like and a share as well. Help us get word out there. And we're going to try our hardest to bring the content that you really want and bring in the people that you want us to talk to on all the subjects. Thanks very much, guys, and we'll see you on the next episode.
Thanks for tuning in.